Guys, welcome back to Leah's Vlog, where I discuss all things nursing and my personal nursing journey. So if you're new to my channel, my name is Leah. I am an orthopedic nurse. I've been a nurse a little under a year now, and I love my career, but I just want to be honest. There are days that I just feel like I do not know what I'm doing. I feel like nursing school didn't teach me enough. My time with my preceptor was just not enough. And so I want to share with you all the things that I have learned and the things that I'm currently learning just to help your journey, just to help you along in your journey. So today's video is just a little different. I recently just got off work and I just had to share because in the midst of this pandemic, there's been so many different changes, and I have a video that even talks about some of the changes that have been taking place. But I just want to talk about one thing that I have been encountering just a lot, and that is a difficult patient. Now, let's get into this because I have so many tips, but I'm just going to give you the first 5 tips that I think that will help you survive dealing with difficult patients, because nursing school does not teach you how to deal with someone who has multiple psych disorders, someone who's combative, someone who's in soft limb restraints, and they're trying to smack you, trying to give them meds, they're trying to hit you. They don't teach you how to deal with this. And you also have difficult patients that are just very needy, who want you to be in the room like nonstop, where you have 4 other patients and sometimes 3 other patients, and you have to prioritize and find time to not be rude. So I'm just going to give you the 5 tips that I have learned or I use in order to help me get through a shift where I have difficult patients, and sometimes I have more than one difficult patient. So tip number one is to basically not have any preconceived notions. And what I mean by that is a lot of times you get report from your nurse that had them for that shift, and they say, look, I just want to warn you, this is going to be a terrible patient. And a lot of times I used to be like, I take that note, and I would just be like, I walk in there with that view that the patient is going to be terrible, and they were not. So what I have learned is that you should not judge a patient based upon someone else's or other nurses' encounter with them, because you are not that nurse. You don't have that same character of that nurse. You don't have that same mannerisms and sometimes the same level of patience that another nurse has. So do not take on what they tell you. You go in and assess that patient and get to know them for themselves. You establish that relationship or that trust with that patient, and you get to know them for themselves, because a lot of times I get reports and say they're terrible, and they're not. So that's tip number 1. Tip number 2, treat your patient as you want to be treated. A lot of times this is easier said than done, but I know that from the moment that I started nursing, that I vow to treat my patients the way I want to be treated, and it has saved me so much heartache and pain during my shifts. So this means basically from the tone in which you're talking to patients, from your body language, from the way that you basically administer your skills to them. You treat them as you want to be treated. If they are agitated, you be patient with them. If they ask your question over and over, you watch your tone and how you talk to them. A lot of times patients can tell when you are agitated or irritated with them, so talk in a very soft and calm tone, and do not show that you're agitated. You make them feel like they are the only patient in the whole wide world, and I'm telling you, that will change that patient. It will change. I have got so many good results just in that manner. And if you have to go out and regroup yourself, do that, but treat your patient as you want to be treated. Tip number 3, find someone to connect with your patient. I've had a few patients with psychiatric disorders, and there are certain things that sometimes they like to do, like repetitive motion things such as coloring and drawing. And some patients without psychiatric disorders, they like to read or they like movies. So a lot of times my patients love movies because they're sitting in the hospital all day, and so I know how to go on the TV and find movies, because a lot of times they're not oriented to the call out and how to use it. So I find a way that I go in and I say, hey, do you like movies? And I show them, how to get to the movies, and then we talk about the movies. I talk about some things that I like about the movies. Even if there's something that I don't even like, I just find some little thing to connect, or I compliment them, maybe on their nail polish or on the music that they're listening to. Just find some way to engage in a conversation and connect with them, because that makes them feel like, wow, they really are thinking of me. They're trying to basically form a relationship with me in these 12 hours, and that basically softens their heart towards you. And that patient sometimes they have turned into, sometimes my worst patient into my best patient. So find someone to connect with your patient. Tip number 4, So I'm going to be honest, not all patients are going to basically be your best patients. Some of them will be combative. Some of them will try to hurt you. You protect yourself at all times. You make sure if they are combative, you know their security, how to reach your security. Either have it on a badge. I put my number, all my important numbers on my badge. I have my phone near me. I always make sure that if a patient is prone to basically be combative or any of that sort, that I know what I need to do in order to get a restraint ordered for them. I know what the restraints are, and I protect myself. I always make sure if they are, prone to kind of hit me, that I'm not in their face and I'm not trying to agitate them. So protect yourself. If you have police officers there, you already know you can, again, like I said, reach out to security or police officers or of that sort, but protect yourself. And lastly, tip number 5 is to remain calm. Remain calm. And a lot of times, again, that's easier said than done. But if you need to basically say, hey, I need a moment, I'll be right back, make up some excuse to go out, maybe vent to one of your coworkers or to your charge nurse if you're cool with them, and just let them know what's going on so that when you come back into that room, you're refreshed and you're able to be, again, calm, patient, able to connect with them and basically administer care to them in a very good way. They are your patient. You're responsible for their care for that 12 hours. So love on them. Do exactly what they want. If they want some water or they want something as minuscule as just like something as little as just some cream off the shelf, do that. Those are your patients. And it will sometimes change your day. But if it doesn't, protect yourself. And always remain calm. So that's my 5 tips on how to deal with difficult patients. Nursing sometimes is not easy. It is hard. There are days where I come home and I'm just like, I don't think I want to go to work for the next 5 days. But these tips have helped me deal with difficult patients. So I hope it helps. All right, I'll see you in my next video.